So, this is our school's nursing department, and so they're going to introduce themselves and tell what they do and how they service our school, incorporating technology in the nursing department. So, we can start with.
My name is Clyde Daigle, and I'm a pediatric nurse practitioner with the school-based health centers. St. Patrick's Hospital's got a school-based health center in this school, and I'm the pediatric nurse practitioner here and at Clifton.
And I'm Missy Conrad, and I'm the office tech here at Conbury-Fondale. I work here 5 days a week. I just stay at this school.
I'm Kimberly Delafosse. I'm the registered nurse here at the School-Based Health Center at Conbury-Fondale Elementary.
And I'm Diana Frugier, and I'm the licensed clinical social worker, and I'm here at Conbury-Fondale 3 days a week in the School-Based Health Center.
And so basically today we're just going to talk about and have a conversation on, I know we see plenty of students here. They love coming to the health center. And so we're just going to talk about how you all incorporate technology into what you do on a daily basis here with the students, and just pretty much how you service them using technology. So.
Okay. Well, the main way, as a clinical social worker, my primary responsibility is counseling with students and working with them to make sure that their emotional needs are met and to make sure that they're successful in school. One of the main ways that I use technology is our medical records is electronic and on a program that we call AthenaNet. And the benefit of the technology is that it makes keeping records more streamlined and quicker. Especially in mental health, there is a lot of documentation, and it allows me to see more students because of the fact that I can do it electronically and it's quicker. And it allows, like, we're an elementary school, but our students feed into the middle schools and high schools. And by having the records electronic, and once they go to the new school or one of ours changed to another elementary, our staff at those schools can automatically pull up those records, and that provides for continuity of care, which is really a good thing. Another way that I use technology is just with the computers. A lot of times, especially children with this age, you wouldn't do what you would consider traditional counseling session where someone like sits on a couch and talks about how they feel. Children benefit better from play therapy or doing role plays and those kinds of things. So one of the ways that I use technology is with a computer, even like little cartoons. Like there's several programs that I use that have like anti-bullying cartoons or things like that. And of course children are more engaged and interested in that, and so we'll watch some of those programs, and then maybe you'd use it and do a role play afterwards. So that's the ways that I primarily use technology.
Okay, let me ask you a question. With students that you service, what if they transfer to schools that do not have a U in place at their school? How does that work, and if they still need those particular services?
Well, what would happen in those cases, if they don't have a school-based health center, I have plenty. What I have to do is, and which I also do here for some students, is make an outside referral, just like I would, anywhere else, to a private counselor or sometimes a group that does services, and they can still access those records. They have to have a release of information, and then I would send them like a report or something like that.
Now, would they come to the school and see them, or they go visit the home? No.
Well, it depends on what agency. I mean,
okay.
It depends. It's all different. I refer out for all kinds of reasons, not just counseling.
Yeah.
It could be a lot of what I do may be referrals for food assistance or something like that. So it may be a referral to a parent. But if it's a child that has been here and been in counseling and needs outside counseling, what I normally do is give the parent 3 options and let them choose.
Mhm.
Or sometimes we'll have a student here that needs more intensive services, and I'll refer out. And in that way, I guess I use technology, because if I have a release signed from the parents, then I can make that referral for them and do some of the work to make it quicker. For instance, one agency that we use a lot is Resource Management, and as long as I have a release, then I can actually make the referral themselves if I feel like that is the appropriate thing to do. It saves time and probably gets them onto the list a little quicker than if the parent would just go and do it themselves.
Right. All right. Sounds good.
Okay. Next. The way that I incorporate technology into the care of students through the nursing aspect also utilizes our electronic medical record, Athena. Whenever I see students, for whatever reason they access the clinic, I can document my results in the Athena or into the electronic medical record, which becomes visible or accessible by Clyde, Mr. Daigle, our nurse practitioner, because sometimes he's not here at the school with me. So if I see a student and I think that it warrants him seeing the student as well, I can enter the information in, of course save it, and then contact him and say, hey, take a look at what I've written on this student. We can even upload information on where, if it's a bruise or wound, where it's located. So when I call him and I say, hey, take a look at such and such record, he can access that information when he's on site at the other school, and by the time he gets here, he already has a working knowledge of what he may have to deal with. So it not only makes for, quick, like Ms. Fruge said, it not only makes us able to see students more quickly, but it also allows that continuity of care when one practitioner has to take over for another practitioner because you have the information at hand. Also, if we have a student here at Conbury-Fondale Elementary who transfers out to, say, Clifton Elementary, that nurse who's over there can also access and see the history. I mean, even if the child is in 5th grade and that nurse needs to access what that student's health history was when the child was in 2nd grade, as long as that student was a member here in the clinic and utilized our services, that nurse will have access to it. So the electronic medical record really does provide for continuity of care for our practitioners, and it just makes things easier. I also find that through the use of the electronic medical record, it reduces the cases of medical errors, because it's clearly typed in, so you don't have to interpret someone's handwriting like you would with the actual paper chart. So if I'm supposed to do XYZ, it's clearly written out and typed out in the record for me to see and understand what it is I should do. And if someone is reading my notes, it's clear to them what I've done. They don't have to interpret anything in terms of handwriting, because as you know, medical professionals sometimes have messy handwriting. Also with technology, we have goals in place where we have to do a certain amount of education with students. I was just talking about the education that we have, our goals. We have goals through nursing that we have to conduct various forms of education with our students and comprehensive goals. So what I do from a nursing standpoint, this particular year, for instance, we had to address hand washing and asthma management. So I used technology for students to look at this hand wash video through the Blackboard system. So they were able to look at the video and see what Henry the hand washer talked about, and they were able to, repeat, some of the steps and the things that the video had demonstrated. Also, with the students who were asthmatic, they were able to look at the videos as well to see how to correctly use an inhaler, so that we could then check them off after they had watched the video. So, we were able to incorporate technology for education as well. And, you know, Mr. Daigle will be able to add more to that from his standpoint. But the final thing, or the final way that we utilize, or that I utilize technology is through a program called LINKS. And through the School-Based Health Center, we are able to administer immunizations. And so our clinic has access to the state's system, LINKS. So we're able to access the system to see what immunizations the students need, which ones they've received in the past. And so we can administer those immunizations here, enter that information into the LINKS system. It then becomes accessible by anyone statewide who has access to the LINKS system, real time. And then we are also able to print out the state report for students to take home to their parents that will serve as a legal document showing what their immunizations, their updates are. So,
That way all the physicians are
Yes.
networked together.
yes, and anyone who has access in this state to the LINKS system can see what we've entered here at the School-Based Health Center. So there's no duplication, so
Right.
it helps for reduction of costs and no unnecessary administrative medications, because they see it, like I said, real time that we've administered it.
Now, when you said you, like the students are put in a database where you enter their information into that database, has there ever been, you know, if you can, or an instance where, or is this even possible, where like if a student, you know, you've seen a student or a patient, however you say it, and you've input their data into the system. Now, this system is just for us, or is it between all of the health centers in the district? Like, if something happened to a student and you saw a student that needed to go to the hospital, you know, if it got beyond
yeah.
what you need to do, is there a way that the hospital or doctor's office could access this same database that you all?
We can send a report from our electronic medical record to that particular student's primary care physician.
Okay.
Now, if the student is going to the emergency room, then of course we can print out information, you know, and send with the student, you know. But for that student's primary care physician, at any point after any visit, there's a way for you to send a summary of what you've done in that visit. So once again, there are no duplication of services, and the physician is up to date on what's going on with the student. Because sometimes we see and treat things here that may not necessarily warrant the student then going to the doctor's office.
Right.
So when they see the doctor, you know, for whatever follow-up, they can then see that, you know, he had an instance of reflux, we had to do a vision screen because he had frequent headaches and things like that.
Yeah, because I was just wondering, you know, because I know, like this last round, the students were getting their shots, so I didn't know, like, if, you know, this immediately went into a database where, you know, if they went to their regular doctor's visit or whatever, the doctor could see, hey, they received their shot at
Yes.
school, or, you know, I know we have the, I was going to say ear, eyes, and nose, but the vision and the hearing screening, so all of that is in that as well.
Right. If
Okay.
we
Yeah, that would go in
conducted-
Athena and in the LINKS
Okay.
program.
Because I know we use as teachers the orange cards
yeah,
to put in
yeah,
their folders, so I didn't know if it was
Yeah.
like, you know, another way that they.
That's the way the school board
Yeah,
does.
Yeah,
yeah, if
okay.
we conduct a service, we enter it in. Now, every time, if one of the school nurses conduct the screening, if we don't do the screening, it's not in for ours. But whenever we conduct the screening, it's in.
Put in.
It's placed in, and like I said, that primary care physician can be forwarded a summary. There's an actual feature on the electronic medical record that we utilize that allows you to send that to the physician. But also, we also have the ability to print off of the electronic medical record educational handouts, information for parents, so that record not only suits us, but it also serves as a tool to gather educational information for parents.
And then one of my main jobs is making the chart. And in the past, we always had to make a paper chart, and which was a lot of paperwork in it. And now I just enter it into the EMR, and I scan their consent in, so that they don't have to pull the chart. They can just click and look at the history, the medical history, all that's input in there. So and then also it makes it, like she said, we have children that go to Clifton because we have a health center down the road, another elementary school, and so sometimes they'll switch back and forth. Well, it's just a click of a button instead of us having to take charts over there. And if Clyde needs to look at a student, like she said, he can just access it from Clifton. And then it also helps with storage, because we had so much storage. Like at the end of the year, we have to pack them up, take it to Avery Archives and all that kind of stuff. So now everything's just on the computer.
So those forms, normally, I know like the health department sends out those forms at the beginning of the year for the students to bring back, and y'all give the books back.
Yeah.
So all of the consent forms and all of that,
Yeah.
that's put in this
I mean, we
system.
still keep a hard copy just in case it goes down,
Mhm.
but we don't. It's just everything's on the computer. I mean, we'd have to put like a growth chart. I mean, we had so many different.
Because I know some students don't bring theirs back, and they'll come back to class and say, "Oh, well, I got to bring my paper back." So I didn't know if it was like you can click on just say Kim Delafalls. Oh, well, I can't see Kim because Kim didn't bring her paper.
Right,
back.
we can't.
Yeah, okay, yeah, okay.
If we can enter it, and if their name's not in the database, we
Yeah.
can't see them unless we have a consent.
Yeah.
Yeah.
Right.
But it just makes it's so much less paperwork.
Yeah.
Because we would have to put so many different things in the chart, and they would have to sit there and chart everything in the hard hard copies, and they don't have to do that anymore.
Right.
And then, like she said, the Links program, I use that too, looking up to see who needs shots, and that way, it's all up to date, because if they get it at their doctor's going to enter it. So it's just a way for everybody to network together, like she said, where there's no duplicates.
Right.
Because it would be in the past, So, and I'm trying to think of what
You
else.
mentioned the growth charts. I think that's another good thing to consider. You may have seen this before. If you ever gone to the doctor with a baby, they're marking the dots on the chart of where the baby is. Well, with our record, each time when we see the student, we're recording height, weight, and vital signs. And so you can actually go to the record, a section of the record, and look at how that child's weight is progressing. So, with us having our focus on obesity, we can see if that student's weight is increasing or decreasing in response to some of our interventions like education. So that makes it really neat. You don't have to flip through papers. You have it right there in front of you, the date, the weight, and all, the body mass index, all of that, the BMI.
And it charts it for you. When you enter that data, it pulls up that chart, and you can actually see the graph. It prints the graph.
And another thing is that if I had a request for copy of medical records or something, if I would have to go through and copy. Well, there is on the EMR, you can just click like extract, a certain part of the medical record, and it'll just print it. Or you can like electronically send it to that physician. So, it helps with privacy and that type of thing.
Another advantage, I don't do it here, but in former employment, I used to have to verify Medicaid coverage or that kind of thing. And, it would take time. You had to call, and sometimes if their system was down, you didn't know. Whereas here, you can pull it up, and it's helped us actually with some people coming in here that didn't have a provider. We were able to look up, Miss was able to look up that they already had their coverage. Or a lot of times we find children under a wrong name or something, and by having it electronically, that we've helped them get like a new doctor, because we had their numbers where the parents didn't have it.
Yeah.
Whereas, if they would have lost their cord, didn't have it in the past, there wouldn't have been if no one knew their number. Now we can look that up.
And I can verify through Athena, the EMR, if I enter, their name and then let's just say their Medicaid number, it'll automatically go into their system and make sure they're eligible. and then it will have that immediately, you know. So they're somehow linked together, and then we're supposed to get linked with links
There's a
so that it'll
vaccine.
automatically go into our EMR if they receive shots, you know, if somebody enters it into links. So that'll be a big help.
Yeah, that'll really be a big help.
One of the things that I like about our medical records is that when I have to write prescriptions, there's a section for me writing scripts that I can pull up any kind of med, click on it. If the children or the parents have provided us with a primary pharmacy that they'd like for us to send that to, it's a matter of clicking and sending an email to them, and the script is filled by the time they get off of school. I don't have to write a script. Now sometimes I do because they don't have a pharmacy, but that's one of the things that I use that for, and collaborating with physicians, our physicians that come and visit here that we work under. Dr. Hutchins is ours here at Comrie. If I need to talk with her or send her a report about a student to find out if there was a child, for instance, there was a child that 2 years ago that had a really bad burn on her leg, and I spoke with the physician. I sent her a report of what I had found, and I was going to ask her if she wanted me to continue to see that child, or if she wanted me to refer her to her. And she said, well, let me see her the first time. And then she called me back and said, you're doing a great job on this. I'm going to let you handle this child. If you run into any problems, then you let me know. But otherwise, keep doing what you're doing, because everything that you charted sounded good to me. And it keeps these kids from having to go make doctor's appointments, miss school, parents get off of work to do that. That's that's some of our goals here in the health department. One of the things I like to speak about in that regard is that when we see a child, we have sort of amongst ourselves in the school-based health centers with St. Pat's in general, one of our criteria is to try to see those children and have them back from the time they leave class back to the classroom in 15 minutes or less. Now we run into problems where that can't always be, you know, a little girl with a broken arm.
Right.
It's not going to take 15 minutes.
Right.
But a lot of the things we can do in about 15 minutes time. So some of our technology is not just with the EMRs, it's with like digital thermometers and blood pressure cuffs and weights and different things, where we can get these kids in, and it's a matter of pushing a button and you get heart rate, vital signs, you know, weight, all that kind of stuff, just to save time and keep that child in school and class.
Right.
So that's a big thing for us here is that technology that is time saving technology. I'm trying to think if we need to say any more about
I think
those.
too, like with you being able to write prescriptions, be able to order prescriptions and send it through the EMR, it prevents a lot of fraud, you know, on part of parents.
Right.
Now, we don't write out narcotics, but say like if the parent wants to double an antibiotic prescription, to maybe have some for later or whatever.
Right.
Well, with them not having that paper script, the electronic medical record doing all of the work, you can avoid a lot of that.
Or them losing their script
losing their
home,
script.
between there and home.
Or even mistakes, probably.
Yeah,
And
once
Because
again, the
people can
handwriting.
read, you know.
The handwriting
and-
issue.
And
like I
doesn't the
talked about.
EMR alert you, like, because we put the, if they're allergic to something,
Right.
doesn't it? Like, instead of having to pull the chart, look every time, then once you enter, like, they're allergic to this, it'll red flag him. You
Yeah,
know?
if you attempt to order something.
Right, that this child is allergic to, and it's a safety valve
Yeah.
for
Yeah.
us to use too. They were talking a while ago about accessing these records, one of the good things about AthenaNet is that all of our school-based health centers, doesn't matter if it's at South Cameron, Molo, wherever, are linked together.
Mhm.
Now, the practitioners can get into the practitioners section of the records. I can't, for instance, get into Diana's records,
Mhm.
mental health things. And I don't think you can get into ours, right, Diana, is that right? Or
Well,
can you?
sometimes, it depends on what it is.
Yeah.
Now,
sometimes
can you, do y'all have the same?
Yeah, we
Oh.
can access, yeah.
We're-
Access.
yeah, we're, yes. And so, but the thing about it is that if I happen to be at Clifton and not here, or even at Molo, or when we're doing chart audits, the NPs have to audit the NPs, the nurses have to audit the nurses. So you don't have to be on site. I don't have to be, for instance, with Ms. Ruth at Molo on her computer to do those children.
Mhm.
I can pull up the ones that she sends me to audit
Based on a number.
based
Oh, okay.
on a number. They give that job. So everything is confidential
Right.
and when we do the chart audits. So that's a big help too for us to save time, and it keeps us on site. I can stop doing what I'm doing with those chart audits at any time and see a patient and then go back to auditing. If I have to be off site and doing it in the old days with the paper charts, those charts are not supposed to be sent back and forth. They're
Mhm.
supposed to be staying in their schools with those children, or just like they would in a doctor's office.
Right.
You know, so.
Another real benefit of having the electronic charts is, like for instance, if a fire drill occurs, before I had used electronic media, if something happened, you had a fire drill, I had to take all my charts and get them out of the
Oh,
thing.
wow.
Or if you would have like a hurricane or something, you know, you don't have to worry about destroying records because it's going to be saved.
Mhm.
Another real advantage of it is scheduling. Like if I see a student and I schedule, instead of having to pull out a schedule, look and see, write it down, I automatically can click, the schedule's there. When I come back to my calendar, I come in the morning, I know exactly who I'm seeing that day. Another real advantage of it is if I do, let's say I make a referral to a psychiatrist, okay, well I can put that into the medical record, and maybe that appointment with psychiatrist may be once in 3 months. Well, I can have a little alert there to let me know, okay, this is the
This is the
time that
time, yeah.
child went there, and I can check with the parent, did you actually make that appointment,
Mhm.
etc. So that's a real advantage.
So now with the outsources that you use, is there a communication between, like, if you recommend a student to, to go to whatever and they have a scheduled appointment and they don't make the appointment, do you get the feedback from the?
Well, I try to get the parent, first follow up with the parent and make sure they make the appointment. I also, when I make a referral, I get a release from the family so that I can communicate by phone. Now, I can't communicate electronically,
Right.
but I can communicate with that psychiatrist, or if I have to send them to a psychologist or something, and we talk back and forth sometimes.
Okay.
But that's by telephone.
Yeah. Okay.
Yeah.
So what are some, I guess, I know we've said a couple, I guess some pros and cons to the systems that you all have in place, some things that you like about it, some things you love about it, some things that, you would like to see tweaked or fixed, or some needs of improvement that you all see in what y'all do on a daily
It's
basis.
a technology age, and people want data fast.
Mhm.
3G at one point was thing, and 4G came along. Now at some point, my 4G isn't fast enough.
Mhm.
So one of the cons is sometimes the software doesn't upload fast enough for us, but that has nothing to do with software, just more so of what we're conditioned to, now. So it's not as fast as 4G sometimes, in terms of getting it like that.
And I think it's a little bit more work up front, time-wise, but once you get it in there, it's in there.
Yeah.
It's probably faster to just hurry up and throw the papers in the chart and, have it in there, but you have to enter all of that stuff in. But once it's in there,
It's there.
yeah.
Well, the disadvantage for me, I guess, in one place, I think the advantages far outweigh it, but one of the disadvantages as a mental health professional, I am not gonna rely just on electronic record. So as where they just document there, I also have to go back and make a paper document. So I'm still doing the other work, no, not quite as much because I don't keep progress notes in there. But anything, if I do like, it's like if I administer some kind of test to the student or something like, or some kind of survey to find out, for instance, like if I'm screening for depression, I a lot of times do a post-test, and when I first start with them, and I'll do a pre-testing when I first start working, and a post-test when I'm done, to see where the levels of depression are. So I'm still going to have to scan that stuff in, you know, into the medical record, but I'm also going to have to make the chart. So that's a little bit of
Now, do you do a lot of scripting versus typing? Like if you're recording your notes?
No, I do now by typing, because electronic, the way I've always had to do before was write it.
Yeah, okay.
And to be honest with you, I like that, you know, because I can put things in there that I know what they mean, that I'm not necessarily want to put in an electronic record.
Right, right.
And then sometimes, I know for y'all, like if they're seeing child after child after child, sometimes they'll have to stop so they can, you know, enter in, because they're...
Yeah, it's,
Well, that was going to be one of my questions to you all. Like when, you know, I know sometimes it's, you know, students, they come. Where, I guess, do you stop and have time to input or document your notes, or, you know, do whatever? Do you do it right then and there, or?
Sometimes you're able to do it while, you know, on the fly, what we call on the fly. You can do it as you go and enter in some of the things. A lot of when we do comprehensive physicals, I try to do that in it, because there's other questions of social history, family history, and other things that are not necessarily in that chart that we have to ask these children about, changes in their conditions and things like that, medicines, exercise, different things that the formats of our records ask us to get. And it's, you know, because we're a state-funded program, the state wants to be able to pull these facts and figures out, you know, on the population that we serve. So it's, we have to, I try to do that as I go. It's not always possible to do that, and you just sort of find time during the day, you know, before, after lunch, when the kids are sleeping, or certain times of the day it kind of falls off, and or at the end of the day. I try to get here first thing in the morning and you know, catch up what I didn't do the day before. I don't let it go several days. I'll try to get it within a day or so. It's not always possible, but I try to do that, or at the end of the day.
templates work good for me
Right.
too. Like, because you know there are going to be some days where they come in and you're on your goal that A, you want to see them within that time frame, and B, you don't want them to wait long while you're entering in data. So it also works good for me to have my little templates that I know of the information I'm at. What was the chief complaint? What were the vitals? So that you can then transcribe your information when it kind of calms down.
I know as a teacher, and I know this is just me wishful thinking, that if there was a way that teachers and you all could have some type of device or email or chat room or something where, because I know sometimes, you know, where y'all are bogged down with students and they'll say, oh, they told me to come back, or,
Right.
you know, where, you know, just as a teacher, if I know a student says, you know, can I go to the nurse? Well, I can look somewhere on a chart or some kind of live chat, you know, well, you know, it's already 3 students ahead of you,
Right,
you know, I'll
right.
send
That
you
would
later.
be
You know, some
great.
kind of,
That would be wonderful, especially for me, because in an ideal world, being a mental health professional, nobody would know the child that's coming to me. The best way I can do it for confidentiality is to call the classroom. So I hate that because I'm in the classroom, but I really don't. I try to avoid going to that classroom.
yeah.
Not because I'm lazy, but because I don't
You
want
don't want
everybody in that class knowing that I'm seeing that child.
Right, right.
And that would be wonderful. I wish we did have a way to communicate, then I could send an email and say, could I see blah, blah, you know,
Yeah,
right now.
and then you can
Yeah.
see them, some type of interactive something,
That would
you
be
know.
wonderful.
You know, well,
Yeah.
you know, can I go to the nurse? Or well, they told me to come back. Well, you know, they still have two people in front
Yeah,
of. You know, we
yeah.
don't have to know who, but
Right.
almost like a number, or you know,
Right.
like you know, you go to a
Right,
restaurant, you know,
When
before
you give you the
we're-
pager,
yeah,
and it alerts when you
Or
can
something,
come,
yeah,
like that,
Because
you
if
know.
he's doing a physical, he could be tied up for 45 minutes,
Yeah.
you know.
And we try to tell the teachers, do not send us more than one or two at a time. We're trying to keep them in school.
Right, but then that doesn't
Right.
mean the other
So that-
teacher
but
does
that
it.
doesn't
Right,
mean
then
that
when
another
y'all
teacher
often
who
like
doesn't
that
know.
pager at the restaurant.
But we
Yeah.
still have some
Right.
teachers that will send 2 or 3 of them at a
Yeah.
time, you know, and
Yeah.
and we try to triage them and send the ones back that we know are not, you
As
know,
a
critical,
cue.
Right.
as a cue. We'll take care of the ones that are sickest first, and then we'll say, we'll call you back when, you know,
Yeah,
when
so
we.
like,
when
they
we're
give you
open.
that
And-
pager and it lights up
Yeah.
when your number
yeah,
is
because
ready.
you know, just because I send a student doesn't mean you haven't sent one, you haven't sent
Yeah,
one. You know,
yeah.
everybody could be sending a student at a time. So that's just something as a teacher, you know, because if they say, oh, send me back in 50, they said send me back in 15 minutes. Well, if I get off going
Right,
on
you're
something
teaching,
else,
yeah.
I'm not gonna remember, you know, to send them back,
Right,
you know, or
right.
whatever. So just, you know, I know that's just
It's
No,
like
kind
a
of
little
pushing
I
it
wish
out
we did,
there.
I really wish we were on the like system-wide email system so that I could email teachers and stuff too,
Yeah.
but we're not linked that
But
way.
even if they're teaching, they won't have access to
They won't
that.
be checking the email
Right,
all
but
the
if they
time.
have that pager like you get at like Bennigan's or is Bennigan's still open? It's closed. Like at
Or like
Logan's or
Outback.
Outback or something.
yeah,
And it, when
That
you
would
have
be a
it,
neat
it lights
little
up
thing.
to know, okay.
yeah. So you won't have, you
That
know,
would help
'cause I said-
y'all, that wouldn't be for me.
yeah, you know, where you won't have students that are just sitting there, or you know, like you said, I'm trying to see one, and then you know, you're trying to chart on
Yeah.
one, but then you got 2 more that
Right,
are waiting.
right,
You know, you
right.
can send them back, and you know, when the buzzer goes off, you know,
Right,
they'll come
right.
back. So
That would
maybe
be
that's
great.
something y'all can take.
It's
to,
not a
to-
big, it's not a big problem, Mr. Clement, because of the, certain times of the year it is, flu season and things
Uh-huh.
like that, when the kids are sick.
Everybody's
Yeah.
coughing, sneezing,
Or springtime
wheezing.
and the allergies are up and they're coughing and sneezing and hacking and there are certain periods of time where it's
Mhm.
not, you know, it's not a problem.
Mhm.
But it's like anything else, you just have these little,
Spells,
you know,
bursts.
these little spells and these times that it can do, and the teachers work well with us, and we just write them a little note saying,
Mhm.
can't see him now,
Yeah.
we'll have to call him back.
Yeah.
We'll have to call them back. And there, you know, and there are phones in the
Yeah.
the
Yeah.
thing, but again, you have to stop the class.
Usually
and
I'll
stop
keep
the
their little
teacher, so-
slip that y'all send,
Mhm.
and
And
then
we know-
once they get caught up or something, we'll try to call them back, you
Yeah.
know, if we can or whatever.
Yeah.
And then I thought of another way that I forgot that I really use technology is with the Athena system. See, we have to report quarterly reports to the state and biannual reports, like in December and then the close of the year. And I can just click buttons and pull, you know, like how many hypertension screenings she's done. We have to report all kind of numbers. How many physicals did you do?
How many diabetic
How many
screenings?
how many diabetic screenings? I mean, they want numbers of what we've been doing in the clinic, and it just makes it super easy. I mean, you know, it just gathers all the data for you. So it
The state wants to make sure we're maximizing their funds. And
Right,
that's-
'cause
I
we're
mean, and
partly
that's-
on the
that's a
grant,
good thing
And they
for-
want numbers,
Now, do
and
you
that
actually
record helps
see-
you.
a certain number of students, like, you know, or is there, I want to use the word quota,
No.
but like, do you have to
Well,
see?
don't
we
have
have
to-
goals.
We have,
Yeah,
we
so-
I
have,
have got goals.
For physicals.
We all
But I
have
see
some.
We have
way
goals for physicals, but not for just urgent care
Visits.
visits.
Uh-huh.
Because ideally, you want to be preventative, you know?
Right.
So we have goals that the state requires in terms of the percentage of the number of students who are enrolled in the clinic. A certain percentage of those students should be, a comprehensive physical should be performed on those students.
Mhm.
So we have that goal. But as far as an overall, you should see 700 students, no. It's more about getting your physicals done based on that goal of that percentage from the state.
But like we report how many shots are given. I mean, it's like they break it down. How many children he saw? How many did the social worker see? How many did she see?
And that technology allows her to be able to pull it based on the coding, the numbers that we utilize to code whatever service we perform or whatever diagnosis we treat. She can grasp, the system allows her to grasp that information and send those numbers to the state.
Mhm.
So it's really convenient in that way.
So compared to the other clinics that are within the parish, or you know all the locations that you all are at, would you say who sees the most patients, or does it vary?
Probably the high school, huh?
Would-
Can you say?
Yeah, probably the ones with the bigger numbers.
the
big, you know,
larger enrollment.
And
the
they have
larger
full-time,
enrollment
like they
schools.
have a full-time
And they
RN and a full-time nurse practitioner, and they have 3 or 4 clinic rooms, so they're
Yeah.
seeing, you know, because usually whenever she's not here, he's here, so,
Yeah.
Right.
you know,
And
they
they
can't
have
see-
like 700 students, you know, at the high school level. So just by nature, they're
They're
gonna
gonna see
see
more.
more, and they get sick, you know.
Well,
high school.
how do you qualify to have a
School-based
school-based
health
health center at a location?
It has to be an underprivileged, underserved area of the state. There's 23 of them throughout the state. We have 4 of them here in North Lake Charles, 2 elementary schools, middle school, and a high school. And then we have one in South Cameron that's
rural
way,
area.
And,
very,
you know,
very
they don't
rural,
really
very,
have
very
any hospitals
isolated.
from the hurricane.
and they have the whole gamut from pre-K to 12th grade
Yeah.
at that school, and so they have a full-time staff and clinic there, and it's a different animal than the Calcasieu Parish school nurses that they have. We have those here. You know, Mr. Christie is a Calcasieu Parish School Board nurse, but we are, if you want to think of us as a doctor's clinic
Mhm.
inside this school. We bill, we write scripts, we do everything that a doctor, tests, run
medicine.
tests, strep tests and different things,
Labs.
labs. You know, to a point, we don't do things like x-rays
Right.
and CBCs and things like that, but we are basically a doctor's office inside this school.
So versus like Christy is school board.
She's a school board employee.
And mostly
Right.
school
St.
board
Pat's- St.
nurses.
Pat's is our-
So this is pretty much 2 separate entities.
Oh,
Right.
yeah,
Yeah, we
Yeah.
are not, we're
Yeah.
not part of the school.
So what does she do versus what you all do?
She does,
She does
Like
a lot of
care
screenings
plans.
and care plans.
So
Yeah.
she sees students
but
as
she
well.
can't,
She
she
does.
can't dispense
They can't
medicine
dispense
without
medicines.
a actual doctor's order.
Other than the medicines like
Right.
you give in the front office with the
Right.
doctors that
Yeah.
she
Yeah.
that's part of her realm that she
Okay.
takes care
They
of.
mosely do a lot of
They
paperwork.
do a lot
Yeah,
of paperwork, they
and-
keep
and
up with the
vision
immunizations
screens,
and stuff.
scoliosis screenings,
Okay.
so,
And sometimes we will find problems with a child and we will refer them to Christy.
yeah.
Because they're Calcasieu Parish, they're under that umbrella, and she has resources for instance, like getting them glasses.
Mhm.
That, you know, they're, through the school board, people work with them to give them glasses and things. So
But
they
no
still-
student can be seen without a consent.
Right, they have
Absolutely.
got to be a
Anyone.
member, they
Right.
have got
Now,
to be
if it's
a
an
member of
emergency
this.
Emergency.
situation, you can, you know, see the student, but you're gonna access 911, you know, so, you know, if it's an emergency situation, the child does not have a consent, but they've had a major fall and they've cut, and, you know,
We
you
can
have to, you
stabilize,
can
yeah.
stabilize them, yes.
And move them on,
And move
you know,
them
move
on.
them on to the emergency room.
But if it's a non-emergency situation and we do not have a consent, we can't see the student.
And our clinic, our 5 clinics all here in this parish are with St. Patrick Hospital. But there are school-based clinics, other places in the states and other places across the nation that are sponsored by other entities. It's just ours is by St. Patrick. And we're partly funded through St. Patrick Hospital and partly funded through grants.
The grants.
And like if we have a consent on them and they have a bad headache, well, he can give them some Tylenol. But like Christy, they can't give them any medicine.
Anything.
Yeah. Now, and one more question before we go. Is the staffing predicated on enrollment?
No, actually,
I don't
the staffing has been
Based on the grant.
based on the
The
grant.
grant's
Okay.
written.
At the time the grant was written,
Years ago.
and it was years ago, and we've kind of wrestled with that because Combry has overtaken in census Clifton, which is a full-time school.
Well, that's
We're a
where
part-time-
that's
And
where I
a
was getting ready to
clinic.
go.
We're a part-time, yeah, we're a part-time clinic here because that's the way the grant was written. I am a part-time nurse practitioner at both of them. She's part-time. Diana's part-time. Missy's the only full-time employee
So I
that we
can be
have.
here when they're all here.
So that was gonna be my next question. With the reconfiguration of the schools, I know we're losing enrollment per se, but then we're getting more. So I didn't know if did that play a part on?
Well, my understanding is, I wasn't here at that time, my understanding, originally when the grant was written, there was not Combry-Fondell, there was strictly Combry. And that's why it was written as a part-time thing, and then they combined with Fondell and made a bigger school. And I understand over the years that they've looked into trying to make it full-time here, and they just haven't been able to do that. They're supposed to be looking at it now again.
Now, who does the writing of the grants? Now I know we're getting off
The state.
but like that's
The
done by the
state.
state or
Yeah,
the,
the state.
oh, okay.
Yeah.
This is Office of
Yeah,
Public
it's-
Health,
yeah.
Health and
Yeah.
Hospitals.
Yeah.
Yeah, and see, they used to go to Combry in an actual like bus and see the students. Like they would make
Little
appointments
mobile.
in
Like
a
the
little
mobile-
mobile unit.
Yeah,
Yeah.
okay.
And it was like that years ago, and then they, wrote the grant. And then whenever this school was built, they added that little clinic.
And the
you know.
schools give us the space. You guys give us our space in our office. You help, you help do some of the house cleaning and things like that, but then as far as supplies and equipment and meds and staffing and, all that stuff that we have here, St. Pat's and the grant gives us that.
Yeah, they do it jointly.
I think everything, all the technology except maybe phones,
Right,
that y'all
phones
give
are
us
covered under
the phones,
CPSD.
yeah.
Now with your I guess supplies or whatever, is that done electronically as well? Like, items that you might need in the gloves and all of that. Do you order?
That's manual.
Yeah.
Oh,
We have to
okay.
order those manual.
I mean, we email what we need and stuff like that.
Yeah, we have a central.
I didn't know, like,
But
if
yeah,
you handled
I
like
think
the order,
that St. Pat's orders it out of Dallas or something. It
Yeah.
goes to a big,
and then they.
We have a central place that we send our
But
requests
we
in
do
for.
ours manually.
we'll say, we need this many gloves, and then they'll do a list of what Washington Mary needs, and and all that. So at the beginning of the year, we'll get tons of supplies, and we'll have to separate them and put them all up.
Now, the hospitals might, be
Right.
technology based, but here at the
Yeah.
clinic, it's a manual.
Yeah.
We just give it to our
Yeah.
boss.
Yeah.
We need. And then y'all pick up your meds at the pharmacy, huh? At St. Pat's, like they'll put in what they need, and then they'll go to St. Pat's and pick up.
Now, do
our
you have to
meds.
check that stuff in once you get here?
Oh, yeah.
Like,
Yeah, it's inventory. We have done the pharmacist comes.
Yeah, the pharmacist comes every couple of weeks to
and
compare.
goes through the cabinet.
Yeah.
to do an
And we do too for outdated things.
Yeah, for
things
expired
medicines that
meds.
expire.
And same with the immunizations, like the state comes and they go through, or even they'll pick them up. And
Yeah, and we have this, like we had the survey beginning of the year where we're audited and everything every couple times.
yeah, you order your immunizations online.
Mhm.
Right?
Yeah, I
she
do
does
order
that
my
through the
immunizations.
state.
Because that's what
online,
was
yes.
that
So she
vaccines for
uses
children.
technology for that.
Yeah.
Vaccines for children, yeah, from the state.
Well, all right. Well, that's about it. So, anything else that you all?
No, I
No,
think
thank
it's
you for letting us tell you our story,
Oh, yeah.
and our school-based health center story.
Well, I appreciate you all.
And we love our staff here. We love y'all.
And we
Yes.
love y'all too. For everything y'all do. Thank you,
Thank you.
We actually made 40 minutes.
Oh, yeah.
No, we made it out.